My name is Gabor Maté. I'm a retired physician with many years of experience in working with a highly addicted population. I'm also an author and speaker. I give talks internationally on multiple subjects, including addiction, stress and health, child development, and trauma. And I've written 5 books, published in 42 languages, bestseller in Canada and many other countries.
I'd love to hear what's your definition when we talk about addiction. How do we define addiction?
And don't ask why the addiction, ask why the suffering, ask why the pain, which means that addiction is not a primary disease or primary problem. The addiction is an attempt to solve the problem. Wounds hurt. When people don't know how to deal with the pain, that's what trauma means. It's a wound. And in this society, a lot of people are wounded. Trauma is not what happened to you, but what happened inside you as a result of what happened to you. So typically, just to give the obvious example, people are sexually abused. That's not the trauma. That's the traumatic event. The trauma is the shame that they develop about themselves. The trauma is that they believe that they don't deserve any better. The trauma is that they believe it's their fault. The trauma is that they get disconnected from their bodies because it's too painful to be connected. So the disconnection is a coping mechanism which then gets ingrained into the body and the psyche and the nervous system. So the trauma is what happens inside you. In other words, it's a wound that's still there in the present. Well, a wound that's still there, it means it can be healed. We can't heal that. We can't change the past, but we can certainly heal wounds that are present.
What kind of misconceptions are you still facing or are you still hearing when it comes to this?
Number one is that addiction is a choice that people make. And since it's a antisocial choice, they need to be punished for it. So there's this assumption of guilt. Whereas I've never known anybody who wakes up one morning on Saturday and says, "Hey, I want to be an addict." You know, people drift into it because, as we said earlier, the compulsion to escape the pain, the suffering, the distress, that though themselves they don't understand. Or they may drift into it because their brains were shaped in such a way by the early environment that they're begging for the chemicals that and the chemical relief that the drugs provide. So there's that first myth, is that it's this choice for which people are culpable, they need to be punished. Now it's true that healing is a personal responsibility. So because you were traumatized, that doesn't mean that you have the excuse to walk around like a victim for the rest of your life. You must take responsibility. If you don't, you're never going to heal. But there's a difference between blame and culpability and responsibility. So that's the first point. The second myth is that it's inherited brain disease, which is kind of like the medical mantra that it's a brain disease largely potentiated by genetics, for which there's virtually zero evidence. And even if there's some genes that predispose some people to addiction, these genes are not determinant because, according to the new science, not controversial anymore, of epigenetics, genes are turned on and off by the environment. So, as one great genetics expert has said, genetics set the sensitivity, the rest is the environment. Or, as somebody said, genetics may load the gun, but it's the environment that pulls the trigger. So it's not a genetic disease. Number one. Number two, it's not a disease at all. It behaves and looks like a disease in some ways. It causes disease for sure. I mean, the people I worked with had HIV and hepatitis C and all kinds of other mental health conditions that either came from the addiction or preceded it in some ways. But like we said, that's not how it begins. It begins with suffering. And the addiction comes along as this desperate attempt to alleviate the suffering.
I found it very interesting that you say one of the myths is that addiction is a disease, because that's something I hear quite often, and that it should be treated as seriously as any other type of cancer.
There's some value in that point of view because at least if you think it's a disease, you're not blaming people. And if you think it's a disease, you're going to offer treatment, which is good. And if you think it's a disease, you're not going to blame people for relapsing. It's not rock bottom that people need, it's support and compassion. It takes a lot of support and a lot of determination. And
Mm.
unfortunately, the medical system doesn't understand this. The average doctor doesn't get a single lecture on trauma. The average physician doesn't get a single lecture how the human brain develops in interaction with the environment, and that the early experiences actually shape the brain in certain ways that makes addictions more likely. The average legal person, lawyer, or judge never hears about this stuff. They just think they're just dealing with criminals. The average teacher never hears about it. They just think they're dealing with kids who have bad behaviors. So the problem is not that it can't be healed. The problem is that the system is sorely lacking in any awareness of trauma and its impacts, let alone its healing. People who get into severe addictions, according to all kinds of studies, not just my own observations, I don't make this stuff up, suffered trauma in their childhoods. When they were helpless, there was no help around. So they say somebody who was beaten or sexually abused or grew up in a home where there was violence in the home, where one parent hit another, where a parent was addicted, where a parent was jailed, where a parent was mentally ill. These are all risk factors for addiction that multiply each other. So the problem was when the child was small, there was nobody around to understand them, see them, or help them. So they don't believe that anybody's there to help them. So it's very difficult for them to reach out for help. Number one. Number two, they may have a distrust of authority figures. Why? Because their first authority figures may have betrayed them or hurt them or left them in the lurch. If you look at which is the most addicted population in Canada, it's the Indigenous population. Why? Because they've suffered the most. If you want a case example of what I'm talking about, just look what happens to the First Nations people and the Inuit people um, here in this country as a result of the displacement, the loss of their lands, their livelihoods, their goods, their culture, and the oppression that they've so often experienced and continue to. If that doesn't teach us what addiction is all about,